Welcome everyone to the Dr. Abs Healthcast. I'm your host, Dr. Brian Episolo, aka Dr. Abs, and on today's show we have Dr. Carly Causey. As a former collegiate athlete and longtime wellness professional, chiropractor and strength coach, Dr. Carly Causey has worked with thousands of athletes, many of them moms. When Dr. Carly had her first son, she noticed a severe lack of stylish, comfortable, and functional sports bras for postpartum athletes. In fact, she vividly remembers lamenting. She just wanted to go to the gym and work out without obnoxious clips, declaring to the world that she was a nursing mom. Ultimately, she wanted to feel comfortable and confident in her new postpartum body and leave the stress behind. She knew that other athletes must be having the same struggle. So after spending time scouring the internet for solid nursing sports bra options and coming empty-handed, Dr. Carly and her best friend Jess decided they had to create a better solution. The two friends founded Jen & Carrie, putting their over 40 years of combined experience in the fitness industry, and created a simple nursing and pumping sports bra that is cute, compressive, and ready to help all postpartum athletes triumphantly return to the activities that they love. Now, Dr. Carly is on a mission to empower postpartum athletes to reclaim their identity behind motherhood. I am so excited to talk to Dr. Carly. So let's bring in Dr. Carly Causey. Welcome to the show, Dr. Causey. How you doing today?
I'm great. Thank you so much for having me.
Good. I'm so happy to have you on. I feel like this episode is going to impact a lot of people. Not only are you a mom, you're a coach, you're a former athlete, you're also a doctor of chiropractic, so fellow colleague. So I love to see that. And just to give the audience a little bit of background on you, like, what is your story? Like, if you had to give us the Cliff Notes version.
Yeah. Okay. Cliff Notes version. Well, I live here in Seattle. I was born and raised in Alaska, actually. So I'm sort of a weirdo in that way. And I played sports growing up my whole life, all the way. I played volleyball all the way through college, and then enjoyed playing beach volleyball afterwards. And it was through sports and athletics that I found chiropractic and sort of the world of sports chiropractic. And then, as it happens for many women, once we start going down the journey of having a family, having kids, I really kind of pivoted my focus to women who are athletic, who want to stay active in that pregnancy and postpartum phase. And once women have a baby, they're postpartum. We say postpartum is forever, so it really means that I just sort of pivoted to helping women mostly. And that's been really fun. It's been super rewarding. And basically now everything that I do, from the multiple companies and businesses that I own to what I do for fun to just being a mom, sort of revolves around women and that period of pregnancy and postpartum.
Yeah. I mean, explain to people how you juggle all those things, because I feel like there's a lot of women out there that, have a lot on their plate like you do, and they struggle. So like, how do you do it? How do you juggle the interaction of being a business owner, being a coach, and helping so many women, being an athlete, being active as you want to do as well, and then also being a mom, which is the most important job?
Yes, totally. Yeah, I have two little boys. So I'm actually just about 12 weeks postpartum right now with my second son. So, it's still a pretty crazy time. I would say there's a lot of scheduling, a lot of shared calendars with my business partners and my husband. But really what I find is that what's important to us is what we make time for, and I really work with patients and I work with people online and women in this phase that we have to figure out what works for them and how we can schedule in. Does it work better to schedule a workout if that's important to them? Does it work better to schedule 5 minutes throughout the day, 4 times? Does it work better to set aside 20 to 30 minutes, whatever that looks like? And so it really is about what you're going to be most successful with, and then figuring out what's most important, right? And obviously the kids, the family, for me is most important, but I own a chiropractic practice. I do have a partner. It's Seattle Sports Chiropractic here in Seattle. And that's super helpful, of course, having a partner. And then my company, Jen & Carrie, is our activewear company that is focused on postpartum athletic wear for women, and I
Is
have
that
a
a
partner in
playoff?
that too.
Is that a playoff Ben and Jerry?
You know, it's so funny. We realized that after, but actually what it is my partner's name is Jess and my name is Carly, but we notoriously get called the wrong name. So she always gets called Jen and I always get called Carrie. And so when we were naming the company, we were like, oh, those are like our, pseudo names like Jen and Carrie. They're like your fun mom friends that know all the details, So we named it that, but now we sort of furthered the problem because now we get emails from people to Jen and Carrie and we're like, well, I guess that's our new name now.
Like my actual name is, yeah.
Yeah. Yeah. So it's confusing, but it's kind of fun.
Yeah.
So yeah, it's just all those things are sort of surrounding, empowering women and getting back to the activities that they want to do, whatever that looks like. And so it's a lot of budgeting time and like I said, just figuring out what's important for you.
Yeah, it sounds like there's a lot of planning, strategic planning involved. What are your, so as far as your chiropractic practice, because I'm a business owner as well, and I know I'm in 24/7, just always time consuming that can be, and you have so much on your plate. Like, how often do you get in there to see your patients?
Yeah. So once I had my first son, I dropped my days down to basically 3 days of patients per week. So I see patients. When I go back, I'll go back to seeing patients in a couple of weeks. I'll go back to Monday, Tuesday, Wednesday with patients. And then Thursday, I'll have both kids at home, just kind of like a, sort of chaos day. And then Friday, I use as like admin, catch up, throw in a couple extra patients if I need there, but working on some of the other stuff.
Got it. Got it. Can you, obviously working with groups of people that I think chiropractic helps the most are pregnant moms.
Yeah.
How many pregnant moms do you see on a regular basis in your practice? And if you could maybe talk about, some of the benefits that moms can experience with chiropractic care, because I having a baby and carrying a baby for so long with that amount of weight, I know it's going to cause some back problems. So I know they can find relief with chiropractic. Can you speak a little bit on that?
Yeah, definitely. Yeah, I would say now my practice is, if I had to guess, about 70 to 75% pregnant and postpartum women.
Wow.
And so we see patients, we see them a little bit longer, especially after a woman gives birth. I always have her come in basically for a brand new patient exam, even if I've been seeing her off and on for years, because she has a whole new body. Like you said, she carried a baby and now that baby's out and this new postpartum body is completely different than what she had before. So I always do a new exam. I recommend people look for a chiropractor who does Webster technique during pregnancy. It's just a little bit lighter force technique. As with a lot of chiropractic techniques, the goal is to create as much room in the pelvis so that the baby can get into a good position on its own. And so you can imagine, of course, you can easily imagine, but the average person can imagine if one of those hips is rotated forward and one's rotated backwards, then the baby might prefer one side or might just not get into that good head down position that we want them in. So that's one benefit that I've seen, is just helping make sure that women are in that good position going into birth. Giving birth is one of the most athletic things, arguably, that people can do in this world, right? So we want them to be prepared. I always encourage people to train. Basically, you're training for giving birth, and that's, chiropractors are one great tool that can be helpful. And on top of that, I think there's other aches and pains too that people don't think about, the upper back pain of a growing chest. And then once the baby comes, you're either nursing or holding the baby, however that looks. There's a lot of, rounded forward shoulders, which translate into some neck pain too, right? And so the whole spine, the whole body is really affected by having a baby. And so it's so rewarding for me to work with pregnant women because they get so much relief. They come in like in so much pain and they're able to leave feeling so much better. And lots of women have other kids at home, right? So it's enabling them to be better moms to their kids that are already here. And then just creating some positive energy and positive like movement patterns for them while they're pregnant too.
Amazing, amazing. Yeah, no, you got women, I mean, superheroes for doing what you guys do. I mean, it's absolutely incredible. So obviously you do work with a lot of pregnant and postpartum women. Can you also talk, besides chiropractic, can you talk about other tools that you use to help women manage specifically that fourth trimester from an athletic perspective?
Yeah, well, sort of like I mentioned, I mean, basically my life these days is like figuring out what tools I can create or how I can help women in this, what we call the fourth trimester, which is that 12 weeks basically directly after they've given birth. And so it starts with my chiropractic practice, right? I love to see patients there and help them sort of manage and maneuver their way back into whatever sort of activity they were into before, if they want to get back to that. And it could also just be managing their way back to not having pain and helping, picking up their kids and doing all that kind of thing. So it really depends on what their goals are. I also have, I developed a few years ago, actually it was right when COVID started. It's called Postpartum Restoration Plan, and it's an online 8-week rehab plan basically. And that was spawned because people weren't coming into the office for postpartum care, during that time. So it really inspired me to get something so that there was this tool for women to be able to follow along with. It's 20 minutes a day, 4 days a week. And I recorded all the videos. So there's, I think, 52 exercise videos that are included with it, which was, I don't know how I did that. I had a young son at that time too, by looking back. But anyways, it's great that I did. And so I have that. And that's another way that I use that with my patients. And then that's available online. And then really the third way is I saw a big gap in the market as I was coming back from having my first son, into getting back into activity and exercise. And it was that I really just wanted a sports bra that didn't have the clips, the nursing clips. If you're not familiar, most nursing bras have big chunky clips right here. And if you're running, they can pop open. If let's say you're doing a power clean in the gym, you can, knock that thing off. And more than that, it just really, for me, it advertises that, hey, I'm a nursing mom, which is great. Like, I love being a nursing mom, but I also wanted this time that felt like it was just for me, where I could be in the gym and I could go to, I go to CrossFit or do your HIIT workouts or do whatever you do, but be there and just be an athlete and just have that space for you where you feel like yourself. And I think that's really special and important. So my business partner and I was sort of complaining to her after I had my first son, and we started looking and scouring the internet, and we just couldn't find anything that didn't have clips or buttons or zippers or Velcro or, all this kind of stuff. So we spent a couple of years developing that. And basically it just looks like a regular bra and pulls up and pulls down. And so you can nurse, you can work out, go back and forth from those two things. And it's designed for athletes. It's designed for high impact activity, for running and jumping and all that sort of thing. So more practically, like on the side of like, actual physical tools, that's one that we've been able to develop. And we're hoping to develop many more. We get emails all the time from people asking about, what about this? And we're like, that's a great idea. We're working on it, of just other things that new moms need. And it's also such a short time that you need that stuff, like in that postpartum period. So we really wanted to develop stuff that they could use longer, So our bra, because it looks like a regular bra, can be used, much after you're done nursing, which we felt was important, because if you're going to spend money on something, you want to be able to use it for a significant amount of time,
Yeah, no,
So that's a little more practical thing, I guess.
Yeah, it's like sleek, modern, very effective. You can wear it long term. I love that.
Yeah.
So, and that basically that telehealth that you were creating with those videos, that's really, really impressive, because I'm sure a lot of moms could have, used that. You could use that during that, specifically during quarantine.
Yeah.
Now, what advice would you give for those moms out there that, they're a little hesitant to get back into the gym postpartum? Like, what would you tell them?
Yeah. I mean, I think there's a couple things. One is that it's your journey, and so if you feel the need to really have that lying in time with the baby, however long that is, which basically means you're not doing much, you know, I think that's fine. And I think it's great and beautiful and it works for a lot of people. If you are anxious to get back in the gym and like, if that's a big part of your who you are and what makes you feel well, then I think the biggest thing is that you don't need to wait for 6 weeks to start that journey, to have that 6 week checkup with your doc, you know. There's a lot of things you can do before that. So I have patients start with breathing exercises. You can be doing those, you know, day one postpartum, basically, you know, there's no issue there. And then we can progress into really simple, quote unquote, simple things that can start to get our glutes firing a little bit again, can start to reintegrate our breath with our body. Because when you're in that newly postpartum phase, there's really no way to describe it. There's no preparing for how like weird your body feels and doesn't feel like your own for a little bit of time. So just getting that breath work going and actually, you know, getting the diaphragm to expand, because during pregnancy, everything gets so crammed up there and the baby is taking space and your organs are getting moved. And so what we see is this lack of endurance in the diaphragm. So starting to build that back up just by deep belly breathing, we can start really early on. And even though it feels simple and it sort of feels silly, it really is when we remind people that the top of the diaphragm is really, or the diaphragm is the top of our core, essentially, if we're thinking about the core as a barrel. Yeah. And the bottom of the core has been like, you know, stretched out over the last 9 months because that's your pelvic floor, right? So if we think of those two areas, we have to start rehabbing those in order to make everything else feel stable. So that's another tip I usually have people is just, we're starting with the core. You can't stabilize anything outside of the core, you know, your extremities, until we've worked on that piece. So yeah, starting earlier than 6 weeks if they have a desire to. And I'm not saying like jump into heavy squats right away. I'm saying start with some easy rehab type of exercises, and it, you know, just to start engaging things and reintegrate those movement patterns. And then also starting always with core work, which core includes, you know, your glutes, obviously your abdomen, your pelvic floor, your low back muscles. It's kind of that whole thing, not just the abdomen.
Absolutely. How long did it take you? I mean, where are you at now? Obviously, you're postpartum yourself. I mean, how long do you expect, you know, to kind of be in that transition phase to get back to, you know, full go when it comes to your workout routines?
Yeah, that's a really good question. And it's a question I get a lot from new moms. And my answer is normally, well, it took 9 months to build a baby, you know, so it's going to take at least 9 months to get back to where you were. Okay. And on top of that, we have to remember that if you're nursing, you still have relaxin in your system. And relaxin is the hormone that loosens the ligaments of the body, loosens the joints so that the baby can come out, right? But it loosens, all right, it works on all the ligaments and joints of the body, not just the pelvis, which sometimes people don't put together. So they're wondering why their shoulder's a little more achy, you know, different joints can be more achy during that postpartum time. That can be one of the reasons. And so until you're really done nursing and not, you know, having that hormone run through your system, then you can really be back to sort of your 100% or whatever. But yeah, I always say it's a very slow road and it's really boring at the beginning, you know, and it feels like, why am I doing this? I just want to go for a run, or I just want to, you know, whatever it is that you do. But I always just caution people taking that first, especially 3 to 4 months, pretty slow, and really easing back in is really pays off in the long run. So
trust the process, you know, take your time, you know, don't overdo it initially. That's some great advice. Do you see any other barriers with new moms returning to athletic activity?
Well, I think in the healthcare profession, when we're working with postpartum women, you know, of course, the thing a lot of people ask about now, it's a big buzzword, is diastasis recti or diastasis recti, depending on where you're from, I guess, how you say it. And that is the separation of the abdominal muscles. It has to happen for the baby to grow, right? So there's some studies that show up to 95 to 100% of women at, I think it's 36 weeks, have that separation. So I always try to encourage women by telling them, it's super normal. It's natural, you know, it has to happen. So we don't need to be afraid of it. But
Yeah.
basically, we just want to have the right tools in place during pregnancy to not make it worse so that we make the rehab harder. And then we want to have the right tools in place in postpartum to recover it. So again, I feel like sometimes like I'm just like saying the same thing over and over, but it starts with the breathing work. It starts with, you know, getting that big flat transverse abdominis muscle that wraps around the abdomen, getting that working and just sort of stabilizing again.
Right.
That's kind of the first step. And then retraining your body of, okay, we can keep this part of our body stable, and then we can start to move our extremities around, and we can stabilize our legs as we move them, and then getting into more functional exercises. But I think that's the thing people seem to be most worried about these days. And it's a concern, you know, but it's also, I think there is a lot of fear mongering that happens in the online space about that. And it really isn't a scary thing. It's like a normal thing that has to happen. And we just need to have the right tools to recover from it.
And I imagine your postpartum program talks about the breathing exercises and basically takes you step by step through that process, correct?
It does. Yeah. Yeah, it totally does. And the other thing I usually recommend is that people check in with a pelvic floor PT. Postpartum, I think, is a great, you know, even if it's just one visit to like kind of see how things are working and get a feel for where you're at. But yeah, a chiropractor and a pelvic floor PT are always my like, okay, you can see them before 6 weeks even, you know, because you're going to be moving around and doing a lot of stuff before that 6-week mark. So there's no need to wait until your 6-week checkup with your midwife or your OB or whoever, you know, you had the baby with. For you as the mom, you can start working on some of those other things sooner rather than later.
Absolutely. Doc, do you have any suggestions or any recommendations on maybe some supplements that could help out postpartum? Obviously, while you're pregnant, you're taking the prenatal vitamins and all that. But, you know, is there anything that you, being a former athlete, current athlete, should I say, is there anything that you take that, you know, kind of just helps you bounce back?
Yeah, I take a lot of supplements and vitamins, as you can maybe imagine. There's a couple of recommendations, especially if women have a C-section. I usually do recommend that they take turmeric, fish oil, and pretty high levels of vitamin C for tissue healing in those first few weeks of recovery, because they had an abdominal surgery, right? So any kind of surgery, we want to recommend, okay, what are, you know, there's no negatives potentially with those things. It can only be helpful to help with that tissue healing. So that's one, especially for the C-section moms out there, that I usually recommend. And I did actually, my last son was breech, and we could not get that little sucker to turn. So we had a scheduled C-section, and I was like, you know, on the vitamins. My husband was like, "You are a crazy person," but that's okay. But
she knows what she's doing.
I know. It was funny because you also are on, you know, Tylenol and ibuprofen and stuff for those first few days. And so we had like this chart, and I'm like, okay, you got to write in where the vitamin C goes this many times a day. You know, I was like, there's a whole system. But as far as just, you know, generally in the postpartum phase, I do generally recommend fish oil. I generally recommend vitamin D3 in pretty high amounts also, and vitamin C also. And then CoQ10 can be helpful in the postpartum phase as well. And to continue with the prenatals, that's one thing that sometimes women don't realize, is that while you're nursing, continuing with that prenatal through that time frame can also be helpful.
Amazing. Now let's talk a little bit about your company. Your motto is, quote, "Every mom is an athlete." Can you tell us why that motto, why you actually came up with that motto and what that means to you?
Yeah, well, it means a couple of things. It stemmed from thinking about, you know, this idea that women can get back to whatever athletic activity it is that they want in the postpartum phase, and that they can be a mom, and that they can still do. I mean, you see it now, which is amazing, with high level sports, with soccer players and volleyball players and runners and all sorts of actual professional athletes having their babies and then coming back to a super high level. And so obviously not all of us are professional athletes, but lots of us have sports that we love to compete in. And, you know, whatever scale that's on, it's encouraging women that you can do that. And we want to empower you to do that in whatever way, shape, or form that can be. So that's sort of one piece of it. And we, as a company, everything we do sort of revolves around that, like empowering women to get back to the activities they love. So, but the other side is that when you think about motherhood and when you think of the terms, every mom is an athlete, maybe lots of women don't consider themselves athletes, but motherhood is athletic. You know, you think about these movements that you're doing, you know, you put the baby down into the crib or the bassinet. Well, that's a hip hinge pattern. You put the car seat up. That's a press, right? You're constantly rotating and grabbing things. And so I always tease that the kind of average thing you think of is like a mom with a car seat in one arm, a toddler in another arm, a coffee in her hand, pushing a cart. You know, it's like moms do crazy things. And those athletic movements take strength and stability. And so it's encouraging women to think about, okay, maybe you don't love to go running or to lift weights or to swim or whatever it is, but the things you're doing on a daily basis are athletic. And so we want to change that mindset of helping women to feel stable, feel confident, feel comfortable in their new postpartum bodies. And whatever we need to do that is what we're working towards.
So like you're basically using the baby as like this big human dumbbell, like just
totally
proper form. Yeah. That's amazing.
Yeah,
Yeah,
wall ball, baby, you know, med ball.
exactly. And I love that because I see, you know, sometimes you see on Instagram or Facebook the mom and the dad pushing the stroller, jogging down the street. You know, it's enjoyable for the baby, getting the breeze in their face, I'm sure, and they're getting in some athletic activity. So I love the creativity that, you know, a lot of moms out there, you know, strap them onto the back of their, you know, one of those harnesses, do some squats. So I love that. Yeah, no, that's great. So what is like the message that you want to get out there to women out there to probably prepare for, you know, pregnancy prior to birth and then also for their return to activity? Like what's your lasting message that you want to get across to the audience out there?
Yeah, I think my lasting message is basically that with motherhood, you can still do all the things that you want to do. And there's a way to do it. And it's just about prioritizing what's important to you and to your family, and then seeking out the right tools, the right people to help you in that journey, whatever that looks like for you. And also, like I said earlier, starting off slow and steady into that journey and making sure that you're taking the right precautions, of course, but then also that you're, you know, that you realize that if you have those goals, that you can still work towards them, and you can really do it all if you want. It's just a matter of having the right team behind you.
Love that. Love that. Yeah, I feel like you're a great role model for a lot of the soon-to-be moms and moms currently. Where can women find you to seek your advice and to just, you know, follow that exercise program online, which I feel is like a great idea. I feel like you're really onto something there.
Thank you.
Where can people find you? Drop your handles, your website, so people can reach out.
Yeah, so our company website is Jen and Carrie, JEN and KERI. We're also on Instagram at Jen and Carrie. And then my personal is on Instagram is Dr. Carly, so KARLIE. And then online is carlycausey.com. So that's pretty much where I am. And you can find basically everything about me in those few places.
Gotcha. Okay. And they can purchase your bra on the website as well.
Yep, definitely. We have charcoal and a black, and we're working on some more colors and some more things down the road. But right now, that's it's a high impact bra for a high impact activity, athletic activity, and so it's there. And we have some great reviews. We've had some really cool stories from moms tandem feeding their twins after a race. One mom, we had one gal go to a huge CrossFit competition in Miami and wear it on the competition floor, and lots of moms are swimming in it this summer, which is pretty cool to see. Amazing. So yeah, so check it out.
Okay, awesome. Well, I think people are going to enjoy that product in addition to all this information that you have given us today. So I really appreciate you coming on the show, and good luck with everything. I mean, it seems like everything's going great for you.
Yeah, thank you so much. Thanks for having me. It's been really great.
Absolutely. All right, Dr. Causey, take care. Have a good one.
You too. Bye.
Bye.